this is not their child, it's your child. The point of diagnosis is that you know what to do. You know the skill you need to teach your child, right? Like if you think about the primary concern here is
What do you suggest to be, a kind but squeaky wheel, just to make sure that your concerns are not just being brushed off?
I would say to parents like trust your gut feeling. You know your child the best and you're with your child every single moment, right? And as you read the flags, the red flags on MChat, and if you did not see a lot of sharing the toys with you, the joint attention, and your child come to you and want you to look at some cool toys he has, like, look, mommy, what I got, and you did not see a lot of initiating communication, and even when people are doubting it, you need to trust your gut feeling. Another thing is, okay, so the reason we have a diagnosis is that important is that we know what to do after that, right? And so, yes, diagnosis is important. I think what is more important is what to do when you see the diagnosis, when you are concerned of your child development. So when I was in grad school, I had a developmental pediatrician. I was on the program that's interdisciplinary committee for autism, have faculty from OT, SLP, a developmental pediatrician, and then I was shadowing this doctor who's developmental pediatrician for a couple of months, and then I brought up the idea of diagnosing children in China. That was like 15 years ago. So I was thinking about translate the chat in Chinese. I'm thinking about doing a YouTube talking about the ideas of autism diagnosis. And then this doctor pulled me aside, said to me, so it's great that we are talking about this diagnosis. What is the service looking like in China? What do you do when you have diagnosis but there's no services? Is it ethical to push for diagnosis but you have none to offer to parents? This is important because the point of diagnosis is that you know what to do. Is it should you wait for a year to get the diagnosis and fight about does my child have autism? Does my child not have autism? And the answer for me is no. And while you're waiting for the diagnosis, and shift your energy from waiting to take some actions. There's a lot you can do. You know the skill you need to teach your child, right? Like if you think about the primary concern here is social sharing. Your child ability to share that joint interest with you, to be able to say, Mom, look, the pointing gesture, to direct your attention from very early on age. All these skills you are able to work at home. That's why at the PC, we have the imitation module, we have the joint attention module, we have how to create an environment that your child is motivated. You capture that motivation. And we have the 5 for 15 minutes parent group where we talk about, how do we set things up to start to teach joint attention, to start to teach imitation, and how do we manage the problem behavior we're seeing that are impeding the child from learning. So the important thing is, yes, you are worried, people are doubting you, those are draining your energy. They are really, really tiring to hear people feel like they are not hearing me. I've been telling them my child have some concerns, but people were saying, it's fine, he'll grow out of it. Well, this is not their child, it's your child. And you are the advocate for this child, and you know what to do. And start working on imitation, start to follow your child needs and imitate your child. Be responsive, understanding what target you're trying to teach, what language your child need to learn, and then join one of the 5 for 15 minutes group and start to teach imitation. Our imitation module is free for parents, and pull out and just follow that on a daily basis, find a routine. So do not let other people drain your energy, because your energy is limited. Your energy should be placed on how do I fight for my child and how do I make sure I have 15 minutes per day at least to work on imitation and joint attention every single day consistently.
It's the waiting that's what creates where we could have a great opportunity to help a child grow. And I like that, just talking about being proactive. And it is great. Diagnosis is important, especially in some cases for funding, to get, access to different areas. But you could be proactive in crucial child development skills. Whether they have a diagnosis or not, it's just kind of struggling in a specific area. I think that's where being proactive puts you more in the driver's seat. Instead of waiting 6 to 12 months to get diagnosis, waiting 6 to 12 months to get into any type of therapy, well, that's almost 2 years. And so I kind of like just being proactive and just doing fundamentals, teaching a kid how to imitate, teaching a kid play skills, teaching a kid how to follow simple directions, understand the environment really helps to empower. But most importantly, it taps into that early intervention to really help moving forward. So I'm really glad that you mentioned that, something that we're definitely passionate about. So let's shift and start thinking about some of the misconceptions of autism. Thanks for watching. Are you ready for support? Look in the description below to book a free consultation call. We also have free downloadables from Parent Empowerment Coaching and our quest to help parents fight for 15 minutes. Stay empowered, stay informed. We'll talk again soon.